So when we talk about functional stages of system, we have input, we have process, we have output. Then we have an opportunity to receive a feedback, which will again change the input, the process, and the output. The output is otherwise known as outcome. So outcomes can be of two types: desirable or non-desirable. If the outcomes are not desirable, we give a suitable feedback and change the input. But what do we mean by input in terms of practical resources? What could be in a practical system? What are the inputs? The inputs could come in terms of men, money, material, minute. The resources. These are the resources. Men, the human resource, material, the things which are used to provide the process, financial resources, and time. These are the four resources which are part of the input. They will, once they are in action, they will give rise to process. From process, we have output. Based on the output, we have an outcome which is desirable or non-desirable. Then there's a feedback. Now, can you tell me some systems which you come across around you? Take a moment to think and reflect. What are some of the systems you know, which you regularly come across? Yes. So what systems do we have? There are some of the very common systems we come across. Day in and day out, we have heard of it. Cellular systems, solar system, educational systems. These are very common terms which come in and day out. Other than that, there are thousands of systems: transportation systems, municipal systems, political systems, educational systems, communication systems, health systems, financial systems, air conditioning system. All are a system. All of these have common properties of input, process, and output. So today we'll discuss about one more thing about the mechanical system as an example to understand the system's perspective in medical education. So we know about a car factory. Car factory is a systematic approach to manufacturing cars. In fact, it was one of the first systems which brought into a systemic approach to manufacturing. So as we know, there are a lot of components of cars, a lot of subcomponents, a lot of fine components, and which are all compiled together to give the car of a design. So what is the input here? Input is the design ideas, the manpower, the components, subcomponents, the software, the engine system. Everything can be input. What is the process? The process is the assembly system. All of them are compiled together, assembled, subcomponents are assembled, then compiled. Then what is the output? The output is the car. Now, what is the feedback here? The feedback is given by general public, whether the car is good or car is bad, whether the mileage is good or mileage is bad, whether the appearance is good or appearance is bad. So this is the feedback. Based on this feedback, the car manufacturer decides to change the input. If the sales are very good, they may not change with anything. If the sales are not satisfactory, they may go into some changes and introduce the changes. Again, the process goes, the outcome. If they are willing for a good model of car, then that is a desirable outcome. If the outcome does not satisfactory, there are no sales, people don't like, people reject it, then that is an undesirable outcome. So this is about the car. So they have a goal, which is to create a car. They have interrelated sections and departments, like all the subcomponents, and they have the stages of action: input, process, output, and the feedback. Now let us talk about medical college as a system. When we talk about medical college as a system, there are system goals. There are goals for the system. What are the goals for a medical college? To create good doctors who will be able to give good quality of care to the society or to the place where they are posted. The goal is to create a competent health professional. And then what are the departments of this medical college? There are academic department, the administrative department, there are clinical department, non-clinical department, the research department. Now all combined together to form the department. Then what is the environment? The environment are the surrounding areas through which the medical college can grow. So what we have here, what are the input for this? What is the input for this medical college as a system? So now we see there is the input, there is the output, and there is a process. There is the input, output, and a process. What is the input? Input are learners and resources. There are input. What are the resources? Financial resources, educational resources, the teachers, the faculty, the patients. They're all part of the resources. Who are the learners? The learners who are selected to come into the system to become competent health professionals. The input. So what is the process? The process is we have to create a process for designing or creating excellent health professionals which are useful for the community. So how do we create the process? We can go by formulating aims and objectives, planning and implementing a teaching learning process, planning and implementing a scheme of evaluation of the to assess the outcome of learning. So first we formulate our objective, aims and objectives. What do we want? When we get some resources, the student, the learners join in. What do we want them to become? What should be they competent in? Should they be competent in only surgical field? Should they be competent in medical field, or should they be competent in overall? So when we talk about medical and the graduate student, MBBS, we expect them to be competent in multiple fields. When they start specializing, either a doctorate in medicine or a degree in surgery, then we expect them to specialize in specific components. So that is our objective. That is the objective of the system. Like we want to create what kind of doctors. Then how do we implement the teaching learning process? So we first need to plan out that learning process and then implement the learning process by creating schedules, creating classes, by conducting classes, by having group studies, by having small group studies, large group studies. These are all the part of the process of education. Then how do we evaluate whether our professionals who are coming out are what we wanted according to the input, or it can be improved. So that can be the most common method of evaluation is by assessment, by assessing their skills and knowledge. With the all of them, it aims to provide a qualified and certified health professional competent to provide healthcare delivery. This is the aim of our output. So if we feel that our output is not satisfactory, we may have to change the input. Maybe we have to start making our selection of learners more stringent, or identifying suitable faculty, or identifying suitable process which can be used to improve the outcome.